Hello again, and welcome to Trinity Dental Clinic's program for better dental health, where we'll teach you about conditions of the mouth and the teeth, how to spot them, how to treat them, and most of all, how to prevent them. Trinity Dental Clinic is located in the front of ELWA Hospital in Paynesville. We open at 8:30 each day, and we offer dental services including extraction of teeth, fillings, cleanings, as well as other advanced care. On today's program, we'll be talking about dental infections, which are sicknesses that can happen under the teeth and around the teeth that can cause pain and serious health issues. Hello again, my name is Dr. Keith Chapman. I'm the dentist at Trinity Dental Clinic, and I'm joined by Frida Schmidt, registered dental therapist, who also works at our clinic full-time. And today, again, we're going to be talking about infections, which are sicknesses that can happen around the teeth. We want to tell you a little bit about what causes them and what they feel like, what they look like, and what you can do to prevent them, of course, and to treat them. And I want to start by addressing a simple issue of what infections actually are, how they happen. And we discussed a little bit of this last week when we talked about cavities of the teeth. So Frida, why don't you tell us exactly what causes an infection in general, not just in the mouth, but anywhere in the body?
Germs. We've all heard the word germs. Some of us know the bigger word for that, which is bacteria. But germs are small living things that are everywhere. We can't avoid them. Germs cannot be seen with our ordinary eyeball, but we can see them under microscopes, and we know that they're there because if you've ever even had a small cut on your finger and you think, oh, this is no problem, and then for some reason it gets very infected, you know that the germs that have been in some dirt or something got into your finger, and those germs have caused that infection. Another thing about germs is there is no way you can keep your whole surrounding so clean that there are no germs. We all have germs in our mouth. You cannot avoid it. We have germs in our mouth. It's just when the germs get so strong, get stronger that your body cannot fight it, then those germs can cause infection in your mouth.
Right, and those germs that cause infections we talked about last week, because those same types of germs also cause decay in the teeth or holes in the teeth, the dark places that many people have in their teeth. And those germs can also cause the plaque, which is the sticky food substance on your teeth. And they convert that plaque into sometimes into tooth decay, or they make your gums ill, the flesh around the teeth. Those germs can take that plaque and make the gums around the teeth, the flesh around the teeth ill, red, bleeding, and can cause an infection that way as well. So the same germs that cause the tooth decay and the gum disease around the teeth, from those things can cause infections under the teeth from tooth decay or around the teeth. And those infections can cause pressure under the teeth. Usually it happens when the tooth decay gets down to the nerve of the tooth and causes the nerve to die. And we know that dead things do not live, they rot. And because of that process, it causes an infection at the end of the tooth. And that causes a severe amount of pressure, which causes a toothache. And even on lower teeth, people often complain of earache or a pain in back all the way to their ear. And that's from the pressure building up on top of the nerve that gives those teeth feeling. Another reason for a toothache is not to the level of infection. It is caused by the germs, but it's called inflammation. And inflammation is not when there's a full infection in the tooth, but the nerve of the tooth is just irritated, or I like to say angry sometimes. The nerve of the tooth, which is the part that gives it the feeling, is angry. So that part of the tooth that gives it the feeling begins to hurt, begins to be very sensitive to things that are cold, and sometimes this type of pain can wake people up during the night or keep them from sleeping. And it's slightly different from an infection because often people will treat this themselves. I know it's common in West Africa to actually put a drop of battery acid onto the tooth, into the hole, and that if the tooth is inflamed, this will treat it because it kills the nerve of the tooth. Now, if the nerve is already dead, you most likely you already have an infection in the tooth, and so the battery acid actually won't do anything. But if it does help, well, as I just said, you've already you've just killed the nerve of the tooth. And once again, going back to what I talked about before, dead things rot. They don't live, they don't thrive. And so when you kill that tooth with battery acid, it may treat the pain at that time, but some time from then, maybe months, maybe years, the tooth will develop an infection, and you will develop the type of pain that I've talked about.
So what are signs of infection? The first sign I would think would be pain. If you're experiencing pain in any place that you don't understand what it's being caused by, it could be by an infection happening. Then also fever. Fever in a very specific place on your body where the problem is, or generalized fever throughout your body. Then swelling. Often with infection, there is some type of swelling, which is what's partly contributing to the pain that you're feeling. And another sign of an infection could be weakness, or just a feeling tired that you don't understand why you're feeling so tired. But when we have an infection going on in our body, we will talk later about how it affects our blood, and that can make your body feel tired, can make it feel weak. Because of our body's ability to fight this infection, the toothache that you're experiencing, that pain may go away after several days or maybe some nights of severe pain that all of a sudden you notice is subsiding. It's because your body has managed to fight and to destroy that infection. And so, but because that has happened does not mean you just, oh, okay, that problem's gone, it's not going to come back. The problem with toothache infections is they may go away a while, but when anything dies, it doesn't just disappear. Dying things, dead things rot. And you can know that that toothache pain is going to come back to you. And when it comes back, it usually comes back much more severe than it was. And it has also spread. Now will have moved from outside of just affecting the tooth, but it will be affecting the gums, the flesh around your teeth. And from there, it can even move into the bone. And when you get infection into your bone, that's very difficult to treat. So we really want to urge you to take care of this before it gets too severe, before it's more than your body can handle.
Yes, and the thing we really wanted to convey today, the thing that we really wanted to communicate, to tell you, is that dental infections can cause very serious health problems, as any infection can. But dental infections from the teeth are no exception. One thing that can happen, as we already talked about, there might be a swelling present. And if that swelling from a tooth can often be in your throat. So if that swelling is present in your throat and it starts getting bigger and bigger, it can actually close your airway. In other words, it closes up your throat and you're unable to breathe. And there's a fancy name for this called Ludwig's angina, but you don't have to memorize that, but just know that's one serious complication, one serious thing that can happen from a dental infection. And another is that as we've talked about, the infection can get into the bone and actually kill the bone and cause more serious problems. But also the infection can basically get into your blood, go throughout your body, and weaken your body. It basically shuts down all of the parts of your body that make your body function normally. And I've seen a few people almost die from this condition. It's very serious. It's often called blood poisoning, or the fancy name is septicemia, but it can cause serious health issues and even death. And also, if you have heart conditions or heart problems, or even if you don't know that you have heart problems, because many people don't, the constant infection and bacteria or germs in your blood from these infections around the teeth and the gums can make your heart problems worse, or even cause bigger problems with your heart. We suspect that from one of these things, blood poisoning or the airway, the throat that is closed off, or heart conditions, we would suspect that several people die each year in Liberia from dental infections that could have either been treated or, better yet, even prevented.